Hello, I am Dr. Vikas Gupta from Hand to Shoulder Clinic. Today we will be talking about trigger finger and trigger thumb. Trigger thumb, first we'll start from trigger thumb. What is trigger thumb? Trigger thumb is whenever we are moving the thumb, there is this noise or there is a kind of a obstruction in the movement of the thumb. So it is occurring in the two stages. One is very newborns or childhood and another one in old ages. So first we'll talk about newborns and small children. Usually they have a small nodule in the tendon and which gets stuck in the A1 pulley. So in the trigger thumb or trigger fingers, what happens, that there's a nodule in the tendon which gets stuck in the A1 pulley, and this is the tendon and this is the pulley system. And when tendon is passing through the pulley system, just think of it like a fishing rod which has multiple pulleys and a thread. So if there's a knot in the thread, when it passes the pulley, it gets stuck and makes a sound. Sometimes if knot is too big, then thread will get stuck. So same thing happen in the tendon. If the nodule is bigger, then it doesn't move, it doesn't allow movements. But it is, if not that big, then there is a triggering noise as well as some amount of pain. So if once we have known the mechanism of trigger finger and trigger thumb, we decide our treatment according to the severity. If there is only pain and small amount of sound, then we start conservatively. Conservatively means physiotherapy, medicines, and sometimes if it is not affecting, then we can give a local shot of steroid. In children, we avoid steroid. Children, we start with the physiotherapy, but if tendon gets struck, that means there's no movement and patient has something like a deformity like this and patient is not able to move thumb, that means tendon is stuck, then it is a time when we have to take a decision about doing a surgery. Surgery is a very small surgery in which we release the A1 pulley and allowing the tendon to glide properly. But in adults, we wait for much longer time because here most likely causes inflammation because of overuse or degeneration. So many times we do conservative management, physiotherapy and medicines. Inflammation goes down and patient can become better by conservative methods. But suppose even after 6 weeks of physiotherapy, patient is not getting any kind of a relief, then we give a steroid shot. It's a local steroid shot which reduces the inflammation, reduces the size of the nodule, which allows tendon to glide properly through the pulley system. But sometimes what happens, even steroid injection is not helping us, then it is a time for doing a surgery, because when physiotherapy and steroid is not helping, then we do the surgery straight away, in which we release the A1 pulley. So in adults, indications of surgery are, once is non-response to the conservative management. Second is pain is so severe and tendon is stuck, it's not moving at all. Then we can bypass the first and second method and go to the surgery directly. Surgery is usually a daycare surgery and it can be done under local or very short anesthesia depending on the patient. But after surgery, there is a dressing for 2 weeks, and either we can put absorbable sutures or suture removal can be done after 2 weeks. After surgery, we allow some amount of physiotherapy movements and patient can expect good results after surgery. Now I will ask Dr. Sheetal, she's an occupational therapist with us, to tell us some home remedies, simple exercises which can be done in initial stages. If you're getting better with it, it's good. If not getting better, you must see a physician after that. So Sheetal, can you tell us what can be done at home, simple things so that patient can do themselves for the trigger fingers?
Okay, for trigger finger, one can do soft massage at the end of the digit. It can be done clockwise as well as anti-clockwise. There should not be a lot of pain while you're doing it. It should be done in a comfortable zone. And then secondly, you can do contrast bath by putting your hand half a minute in warm water and for 1 minute in cold water. And you can do it for 10 to 15 days continuously, and for 5 minutes each. Like you do it for 5 minutes and then you can relax, clean it. Don't sit in the effect of the air or the fan or the cooler. And then you can do slow stretching of each finger. Each finger should be slowly stretched again in the pain free zone. Like it should not be very painful to you. You should do it comfortably. Rest your hand, be comfortable, and stretch each finger slowly, one by one.
Thank you, Dr. Sheetal. Thank you.
So much.
I think patients will be helped.